I'm from the school of thought, I love basketball. If I have LeBron James on my team, I'm not gonna make LeBron James sit on the bench and play my fringe player first and then bring him in the fourth quarter to win the game. We're not gonna win the game like this. Fighting cancer is you are in a battle. You wanna be victorious from the beginning. I want to use my best agents from the beginning. What do you say to that?
Well, I will say, I will put myself in the shoes of the trainer of the team that has a long season in front of him with many games. And so I think the best part of DXd is that it allows us to tailor treatments more than we used to before. Like you know that breast cancer is heterogeneous. Metastatic breast cancer is heterogeneous in the clinical course. And we always look at these guidelines that basically are not heterogeneous, are homogeneous, are always the same. You do first CDKs and then try another line and then chemotherapy. In truth, now after DB06, we know that among these patients, if we are concerned that they are having a bad progression of disease, they have an aggressive tumor, T-DXd works much better than chemotherapy. It clearly outperforms chemotherapy. And so if you're concerned that the patient may not get to the next line of treatment, T-DXd is the best treatment that you can give to that patient to rescue and to ensure that the patient has got the best outcomes. Then on the other side, you have some patients in which instead you may want to wait before you use your best cards just because the disease seems to be indolent. Maybe it's bone only. Most of the patients in DESTINY-Breast06 had visceral metastasis. There were only 3% with bone only disease. So for those patients with very indolent disease, maybe capecitabine, that is oral without alopecia, can still be thought of, knowing that you're going to use T-DXd right after, because it still remains the best drug that we have. And so I think now I consider this as an option for tailoring my treatment choices. As you said, like if the patient is experiencing a rapid progression, a visual progression, symptoms from the disease, we know that T-DXd is the best drug you can use after endocrine treatment. If the patient instead has got a very long time on the prior treatment, has got indolent disease, maybe just a new bone metastasis, maybe I can try to wait a little bit. And in truth, I think we are still talking about this because we don't have yet overall survival data that is mature. Probably mature overall survival data may change all this, and we may start using T-DXd even for those patients with more indolent disease.